loved that about that field. And I also liked dealing with acute patients. I realized that I enjoyed like the severity of cases more than outpatient setting. So that's why I picked internal medicine. And then when I was doing my internal medicine residency, during your residency, you rotate through all specialties. So when you're doing your internal medicine residency, you'll rotate through oncology, cardiology, lung, the lung doctor, pulmonology, rheumatology, endocrinology. It's just the ologies are limitless. and and when I was rotating through different specialties, especially oncology, I realized that there was a certain, I really liked spending time with patients and their families. And I really liked explaining things to them. I liked pain management for cancer related pain. And and I felt like so I did a rotation in palliative care and I really liked dealing with, you know, end of life patients. I felt like I really connected with them and I was able to handle it. It's not a field for everyone, but it's an important field everyone should be familiar with because all specialties in medicine will have patients that will require palliative care. And so it's just a good specialty to be aware of what it is. And then why MDO over MD? I applied to both schools. I applied to DO schools and MD schools. I got into DO school in New York, and I was from Texas and I wanted to move to New York City. So it was kind of, because of the location. And I like the DO philosophy of the mind, body, and soul. Probably one of the reasons I chose this specialty as well, because we deal with patients as a whole. And I felt like there was no difference in the training between the MD and DO. Everything is the same. You match into the same exact specialties. But with DO, you also get the osteopathic side of things where they treat you manipulation, body manipulations, which I thought was so interesting. And so that's why, I picked being a DO and I absolutely love it. And I'm a proud DO. So if anyone has any questions, you can always reach out to me on my Instagram. It's probably the account I'm most active on. It's dr.lalani, Dr. Lalani, and you can add me and I try answering as many questions as possible on there on my Instagram as well, because a lot of med students reach out to me. And then let's see. How can I prepare myself? Does volunteering at hospice helps? Volunteering anywhere helps. Anywhere where you're helping patients, whether it is, just even, translating something for patients during this COVID time. But you always want to be careful. You don't want to, especially right now during the pandemic, a lot of hospitals are limiting the amount of students that come in because no one wants to put, students at risk. You don't know, what risk factors you might have. So obviously during this time, it's a little difficult. And, when you apply, I'm sure committees will understand. They'll understand that it was a pandemic and you couldn't just find people to rotate with. When I was in college, I called up a lot of doctors' offices and I told them like, hi, I go to University of Texas at Austin. I'm a pre-med. I'm very interested in this field. Can I come and shadow you? A lot of times doctors will say no. My parents were not doctors. I don't have anyone in my family that was a doctor. So a lot of it was kind of, hustling. You kind of have to hustle on your own. But so don't, feel free to like ask people, like, can I shadow you, especially if someone's close to you. But just also be mindful that during the pandemic, no one wants to put anyone at risk. So the opportunities have gone down, but understandably so. Your health always comes first. So. How were you first introduced to palliative care? I was introduced to it when I was in internal medicine residency, when you rotate through all different specialties in medicine. And then, how do you answer the question of why you want to be a physician? I feel like this is the most common question asked, and you just kind of have to be honest about what it is that you really got your interest in medicine. For me, I always said that I absolutely love science. I was, always interested in science even when I was younger, and I liked dealing with human beings. So that was just like a perfect fit dealing with, you get to practice science, you get to study, and at the same time, you also get to help people. And I know it sounds corny to constantly say I just went into it to help people, but I feel like that's why all of us go into it, to help people and for the love of science. Um, Can surgical specialties go into DO school? Yes, there are a lot of surgeons, orthopedic surgeons, spine surgeon, all type of specialties can go into DO. So a lot of DOs are surgeon, a lot of DOs are internists. DOs, occupy all fields of medicine. So you could do anything going into it. And then how do you stay professional in a very emotional situation? Is it okay to cry and be emotional in front of the patient? Yeah, I think being a human means that when you see these really tough cases, it's going to get to you, and there are going to be times you're going to cry. And being a cry just shows that you're a human being, and there's nothing wrong with that. In the front of a patient, it depends on how you connect with them. There are times, we cry, and that's okay. Obviously, if you feel like you're crying like every single time and it's really difficult for you, then it's something you just have to reflect on. There's also a lot of things I do outside of medicine to kind of keep me sane. I have an amazing support system with my family and friends that are always supportive and a supportive partner, and everyone is just very, involved with me and making sure I'm okay mentally. And so I'm very blessed when it comes to that. And also, I practice meditation. I do self-care. You have to take care of yourself, especially when you'll be studying or when you're going to be in med school and residency. Self-care is so important, and it's something we always emphasize, because taking care of yourself means you'll be able to take care of patients better. So yeah, definitely there are times it's very emotional, but at the same time, you learn, you never get used to seeing people die. That's not something that will ever happen, because it's always difficult to see someone die. But at the same time, you learn healthy coping mechanisms. You learn to talk to people, you'll be very close to people you go to med school with or you do residency with. So you learn to be involved in their care. And you learn to, you kind of realize, okay, you're all in this together and you're going to go through it together. And yeah, that's majority of the questions. Thank you so much for having me. I hope this was very beneficial to you guys.
Thank you so much for coming. Yeah, I personally learned a lot, and I'm sure everybody else did too. So yeah, thank you so much.
No problem. Let me know if you have any questions. Feel free to reach out to me through IG. I try answering the best I can, but I get a lot of questions. So I'm gonna type my thing here. Thank you. Have a great day.
Thank you.
Bye.
Thank you.